Without further ado, Mark Ornelas.
Thank you, guys. I was asked to give a little presentation about our beach monitoring and public notification program that we oversee out of that we administer out of the Alabama Department of Environmental Management Mobile Field Office. Back as this meeting was originally being considered, and then it got changed, and also here we are. We're going to do this. It's not totally related. This is 100% the exact right place for this, because we do not address HABs in our beach monitoring program through ADEM. First, I wanted to recognize our partners in the program. We work with the Alabama Department of Public Health, Baldwin County Department of Public Health, and Mobile County Department of Public Health. They assist, and we work together to collect the beach samples and to get them analyzed and to put out the public notifications and advisories when there are exceedances. In the B.E.A.C.H Act, amendment to the Clean Water Act, the B.E.A.C.H Act of 2000, authorized a grant for states and tribes to develop programs to monitor the coastal recreational waters. It also requires states to adopt improved water quality standards for pathogen indicators. In Alabama, we have about 50 miles of Gulf beaches and 70 miles of bay beaches, and they are major tourist attractions, bringing lots of people, lots of dollars yearly. The first iteration in '99, ADEM and the Department of Public Health decided to get together and try to monitor some recreational waters. They initiated a program to routinely monitor bacterial levels at 5 beaches. We were only doing 5 swimming beaches to start with, and it was well accepted, and we were able to do it. So we added 6 more beaches later. So the earliest part of the program, we were doing 11 swimming beaches. I believe they were all located Gulf beaches at that time. The purpose of this program was to increase public awareness and allow the users to make better decisions regarding potential health risks. ADEM was designated the state lead agency and was awarded the grant money to carry out the program. And then in 2002, ADEM and Baldwin County Health Department got together to look at the program a little bit more in depth and conducted some sanitary surveys throughout Mobile and Baldwin County to evaluate the risk at the public beach sites. And this resulted in the development of a tiered monitoring program. And I'll explain a little bit more how we've tiered our stations for sampling on another slide. But in the summer of 2003, after the sanitary surveys were conducted, 14 additional sites were added to the program for a total of 25 monitoring stations at public beaches. And that's how many we're currently monitoring today, 25 stations. Didn't know that was going to do that. Our program, we have, there you go, 25 monitoring sites. And the sampling frequency is based off of that tiered system. We have a swimming season that's May through September, and we sample Tier 1 stations twice a week, Tier 2 stations once a week, and Tier 3 stations are sampled once every 2 weeks. During the cooler months, from October to April, we sample all stations once a month. And that's where they were referring to our monthly sampling in the cooler months, because we also collect at every beachfront, at every Gulf front beach, we also collect a HAB sample while we're collecting our bacteria sample, and we shuttle those to the health department for them to run the HAB analysis. The indicator that we use is Enterococcus, and throughout the year, occasionally we will collect some field measurements, including temperature, salinity, dissolved oxygen, conductivity. The indicator bacteria, like I said, is Enterococcus. All the analysis are performed by the B.E.A.C.H Mobile Division Lab using EPA's standard method 1600. That's a direct count analysis using a membrane filtration method. Our standard for whole body contact here is 104 colonies per 100 mils. All all the sampling and handling and analysis are conducted by qualified ADEM and B.E.A.C.H staff. To ensure this is being done to those standards, all sample collectors are audited by our Office of Environmental Quality audit staff yearly to ensure that they're collecting the samples properly, filling out chain of custody, keeping them iced, keeping them preserved the right way during transportation. Each sampling site has signage, color-coded signage, red, green, and yellow. The sampling is done where if we collect a sample on Monday, it's good. It's less than 104. Sign stays green. We collect that same sample and it's above 104. The sign goes to yellow after that first sample, and we collect another sample the very next day. That sample, should it come back good, below 104, the sign goes back to green. Should it come back above, the sign is changed to red, and we continue to resample until we get a good sample, bringing the signage back to green. We don't close the beaches here in Alabama should we get a red sign up. But we do issue advisories through the health department to allow the public to know that the latest samples at that water have showed to be above the EPA threshold. And this is just a map of our sampling stations, all the way from Dolphin Island around to Gulf Shores, Orange Beach, and all the way down to Fort Morgan. So we encircle the entire bay and the Gulf on both sides. There's an example of the signage. A couple of Mobile lab staff doing the analysis. I have my notes at the bottom on my version, but I can't see them, so I don't remember these guys' name. I think it's Craig and somebody else. One of these guys is retired now. The lab folks are in here. But that's a little something they're doing, just counting the plates, counting the cells on the plates. And that's the plates that they, after they've been run the next day, they count those, each of the little blue dots there to give us a number. From 99 to the present, we've collected over 11,000 bacteria samples in the B.E.A.C.H program. 226 advisories have been issued by the health departments. And just last year, from January to December, 806 samples were collected and 15 advisories were issued. 9 of those advisories were issued during the swim season. Now, that's just the number of advisories. In case the question should come up, I don't know exactly how many days each of those advisories covered right here. All the funding, 100% funding, is provided by the EPA, and same for 2019. And the grant for Alabama for 2019 will be $256,000 to do the B.E.A.C.H program, and that has dropped every year for the past 5 years by at least $1,000. So I see that trend continuing. And there's the contacts for the program. Myself and Susie Rice are at the Mobile field office in Brookley Field. There are emails and our phone number. And there's Susie out there getting us a beach sample. We wait out to deep water. We fill the bacteria jar. We bring it back to the lab. They run the analysis. One point I want just to throw out there is the volunteer monitoring question that came up out there. Within the ADEM volunteer monitoring, we look at that data, but we do not utilize it to make regulatory decisions or use classification decisions. But within the B.E.A.C.H program, this is going to be for public notification and awareness. And I don't see anything wrong with based on the simplicity of the collection methods, perhaps allowing volunteers to collect samples whenever possible. The biggest issue is going to be getting them to the lab in Mobile, from the Baldwin County side. That's it.
Or just that.
Yeah.
What do you think it would cost to double the number of samples a year and roll in 2 times a week? 2 times a week?
Twice a week during the swimming season already.
Okay, maybe scratch that question.
Mm-hmm. But I couldn't answer the cost question because we're collecting the HAB samples at no cost. Just roll it into the beach monitoring program, which is a bacterial-based program. We're not doing, HAB stuff. So if we were going to expand it to cover the entire year at that frequency, I guess you would look at twice what we're getting for the beach.
And then that notification, that's.
The public notification, that's also part of the
Well, we're
program.
talking about just once you get the samples back to the lab, you got to ID that, right?
Exactly.
And that takes so much.
You're right. Now the lab has a HAB program. The health lab has a HAB program. And so what we're doing is just
Providing-
supplementing their data, but supplementing their sample load for them to use for whatever purpose they have. And like I said, all we do from the ADEM side is help collect and transport samples.
Yeah, Rick, like I remember a couple of years ago, EPA was considering zeroing out the beach monitoring program. Does that seem a little more stable now?
We see zero on the president's budget every year, but it's been picked up.
Congress puts it back.
It's been picked up and continued.
Brad, that'd be something we'd want everybody to reach out and say, support this program right now.
Yeah, the public loves the beach program. It's one of the most well accepted programs in the department that I'm aware of. It's got a pretty good profile. We got a good place on our website where we post data daily as it's available. We have that map there. It's not necessarily interactive, but it provides you access to information about that location. So if you're interested in going to the beach at those locations, you go through our website and you can bring that up and you'll know exactly what the most recent data showed.
And talking about data, if we want to have some historical data. First of all, how long you have been doing this again?
Since '99.
Okay. So we want to access this type of data. Who should we contact?
It's all available on our website.
Like
Every bit of it, all the way to the beginning.
So we just go and download data.
Yes, ma'am. Some Excel spreadsheet, and you just go to our website, go to programs, go to coastal programs, and then beach monitoring, and it'll take you to a map, and you just click on the site names that you're interested in.
And those are the parameters that you listed, which are temperature, DO, pH.
The only parameters that you're going to have information available on the website is going to be the bacteria numbers and the temperature, or the salinity, the salinity and the bacteria results. When we collect, we only maybe a couple or 3 times a year collect those field measurements.
Okay, so geo, for example, is not collected regularly.
No.
Okay.
I got one question. Do you know if they have at the public health department, do they have the capacity, be it personnel or funding, to process if you were to double or increase the number of samples? With all the people we have on the beach?
HAB samples.
Yeah.
I believe they would. They've told me in the past that they're willing to accept any samples that we could get them in there through whatever means. And that's what they had told me back in October when they were concerned about the red tide progress in Orange Beach. They said, the guys at lab said, let them know if they give us the samples, no matter by hook or by crook, they'll be happy to take them.
As an attorney, I feel like we should point out that the reason that it's bacteria that's tested is because the federal law that starts all this only is for bacteria testing.
Right.
And it does apply to any coast, Great Lakes, as well as the marine coast. And that's why you also have this hybrid of Department of Public Health and ADEM. Mississippi does close its beaches rather than flag the beaches. So it's up to the state to decide how they want to inform the public of the bacterial conditions.